When kids go back to school, many of them will resume participation in sports or maybe decide to try out for a team for the first time. Dr. Jordan Knopfler is a sports medicine physician at Phoebe. So tell me about the Phoebe Orthopedics and Sports Medicine team and how you work with young athletes.
Sure. We have athletic trainers on the front lines who really evaluate the athletes on a day-to-day basis. We want to facilitate evaluation and treatment appropriately to get these athletes doing what they love. Return to play is always important. However, I want to make sure that they do that safely. My passion is the care of the athletic individual, specifically student athletes. We have a great orthopedic department. We have surgeons who specialize in sports medicine, hand, wrist, and elbow, as well as total joint replacement. Specifically what I do is non-surgical orthopedics and also sports medicine, which involves any type of fracture, sprain management, but also other conditions the student athlete may be exposed to.
Talking about student athletes, what really are the primary benefits of young people starting sports?
Sure. The benefits include physical, spiritual, mental, as well as emotional. I think obviously the physical rigors of a sport are important. It's important to understand, healthy lifestyle, physical activity safely. It's one of the only things we have to help combat the epidemic of obesity that obviously plagues our nation and its youth.
Sports obviously does come with some risks though. What are the most common sports injuries that you see?
I see things from your ankle sprains, muscle strains, back injuries. What I have seen is typically on game day, there often are more severe injuries and the injuries occur more frequently.
What are the best ways to reduce an athlete's risk of injury?
One thing we have seen more frequently is overuse injuries in the pediatric population. This is typically because we have year-round sports now, which can be good, but when you're participating in a single sport, you're just involving the same muscles and movements over and over again. Over time, you'll run into stress injuries. You can also run into degenerative tendon injuries. I think overall, just know your body and what it says to you. If you are injured, I would not take any pain medications in order to play. Your body is telling you something. My main goal is to get the athlete back, return to play as soon as possible, but it needs to be done safely.
It's really hot out here this afternoon. What do these guys need to know to avoid heat illness?
Hydration is the key, and this occurs days before the sporting event. So I often tell athletes they need to be hydrating at school days before the event and up to the event. A good guide is to use your urine as an evaluation of your hydration status. A yellow or straw-colored urine is the appropriate level of hydration. If it's too clear, it can be overhydration. Very dark means you definitely have some volume contraction. You need to work on increasing your hydration. If there is any concern for heat illness, the athlete needs to be immediately stopped from play, taken into the shade, and have evaluation.
Talk to me about trying to prevent concussions or minimize the effects of concussion.
Football is not the only sport where head injuries are concerned. Soccer and basketball also has a high incidence. An acute concussion can present with nausea, vomiting, confusion. If you see, witness, or hear of any athlete who has those symptoms, they need to be sat out immediately and they need to have an appropriate evaluation by a qualified health professional. The current recommendation is no return to play on the same day if there is a concern or if they have some sort of traumatic brain injury. We do not grade concussions as minor, moderate, severe. Concussion is a concussion and it is a traumatic brain injury, and it can have some devastating consequences long term, specifically in a young athlete with a developing brain. So it's always prudent to be aware of what's going on.
If an athlete just doesn't feel quite right, feels a little banged up after practice or a game, what do they need to do?
Yeah, well, first and foremost, they need to talk to their coach or whatever medical professional is on the sideline or in the stands. If deemed urgent or emergent, presentation to emergency room or calling the EMS. If, emergent evaluation is not necessary, we do have a black and blue clinic that is open on Saturday mornings. I also do a early morning evaluation, black and blue, specifically during football season. And we start our clinic around 7:30 in the morning. I want athletes to be seen and let them go back to school.
Dr. Knopfler, I appreciate your expertise. If you need more information or need to schedule an appointment at Phoebe Orthopaedics, you can call the main number in Albany. That's 312-5000.